Hey everybody, it's Dr. Aline Potvin. Thanks for joining me again for another installment of Wellness Ed Sunday. And I'm usually outside on the weekends if I get a chance. And today we had wonderful weather here in Maine, and we're able to really hop out into the sunshine if we wanted to. And it really got me thinking, because now is the time of year where I start thinking about how do I protect my skin, how do I recommend protecting skin and preventing burns to my patients. And there's, it's kind of a double-edged sword. There's two, obviously people are concerned about skin cancer risk with increased exposure to sunlight and to UV rays. But as I've mentioned before on some of my Facebook videos, there are incredible benefits to sunlight exposure outside of, the vitamin D production that we do as a result of being in the sun. Sunlight exposure actually opens up our tiniest of blood vessels, or capillaries, and there's actually some really interesting studies that have shown the impact that can have on blood pressure. Not to mention the emotional response that we have to being in sunlight. So there's many benefits that would, while we have to be concerned about skin cancer risk and the impact that sunlight can have on the formation of skin cancer, there's several benefits to being outside. And so cutting out sunlight exposure dramatically is not necessarily a good thing either. So what I always tell people to do is just really get to know your skin well. Pay attention to any, it looks like we have a friend here to hang out with us. Pay attention to what your skin looks like as a baseline. I personally, because I have malignant melanoma that's popped up in my family, I always go and get professional screenings, and I actually have one coming up next month. So that's important for, from my perspective, because of the risk of skin cancer. However, there's lots of screenings that you can do on your own, and so I'm going to give you a nice little tool to be able to do that. So when I'm looking at a patient's skin and I'm looking at the moles and the birthmarks that they have, I pay attention to these letters. A, B, C, D, E. You'll oftentimes see in professional packets just the A, B, C, D part of the tool, but we have to pay attention to the E's as well. So I'm going to go through what these all mean and what to look for, what to pay attention to. So we have, sorry, I'm going to have to get this little cat to kind of stop trying to be center stage because she's knocking around the equipment. But she loved being a star, just for a minute. So we have A, B, C, D, and E. And when I'm looking at a mole or a birthmark on a patient's body or on myself, I'm assessing it by these letters. So first thing I ask myself is, A, is this asymmetrical? And what that means is, if I would take that mole, if it was like on a flat piece of paper and I folded it in half, would we have, kind of perfect symmetry to that mole or to that birthmark? If not, then it's something that we just got to keep an eye on. Sometimes it's not, we do have naturally asymmetrical birthmarks, and that's totally fine. It's if it's become asymmetrical relatively recently or in a short period of time. So the time factor is really important to keep in mind when we look at skin changes. So A stands for asymmetry. B stands for borders. So when we're looking at a mole or a birthmark, we're looking for a smooth, what we call circumscribed border. So it's smooth edges, and it doesn't jut out or get ragged in any places. If we're seeing that there's new changes to the mole that is getting ratty or ragged along the edges, or if there's changes to the depth at the margins, then we have to be more mindful of that. And as a side note, what I oftentimes recommend is that if people have birthmarks or moles that they're concerned about or that they're, wanting to monitor, take a picture of it. Every, if it seems to be changing, it's usually a good idea to go and get it evaluated by a professional. But I recommend, monitoring birthmarks, usually putting an object next to it or a little ruler to show the size and being able to measure that on a regular basis. So, every 3 to 6 months, if it's something that, you just want to keep track of, good idea to take a picture of it. So we have asymmetry, borders, color. So this is something that I think is probably more obvious to people when they look at it. If they notice that there's inconsistency in the color of a mole, let's say you have one that's, got a pretty consistent border, it's symmetrical, but the color has really started to change in the last few months, it's a good idea to pay attention to that and get it evaluated. So with melanoma, we oftentimes see inconsistency in color throughout the birthmark. So you might see, darker areas in one part, lighter areas. Sometimes it even turns to a red or a purplish color within the same lesion. So if there's inconsistency in color within the same birthmark, you definitely want to get that checked out. D stands for diameter. So, generally speaking, moles that are, the size of a pencil eraser or larger are things that we monitor more closely. It's when we reach the diameter of more than 10 millimeters, especially if it's kind of grown to that in a relatively short period of time, we get much more concerned. But certainly smaller patches of skin than that are things that we should pay attention to if we're seeing other criteria that are getting a little bit, inconsistent. So if there's asymmetry, if there's a ragged border, if the color, C stands for color, is inconsistent, but it's a really small, only a couple millimeters in diameter, still is concerning because we have multiple criteria that are that need to be looked at. So we have asymmetry, border, color, diameter, and the last one is actually 2 things to pay attention to. So we have evolution, which means, is it changing quickly over time? Has this popped up only in the last couple months? And is it changing dramatically? So one of the hallmarks of cancerous growth, that the growth is kind of unharnessed. It happens without, being able to be kind of reined in by the body and the immune system. And it tends to be, cancerous growth tends to, because it's happening so quickly, it tends to yield improper tissue growth. So you're going to end up with things that are irregularly colored, that perhaps have a border that's ragged and irregular. Perhaps asymmetry is starting to develop in that mole or that birthmark that you had. So evolution is one of the E's, and the other E is elevation. So when we see that moles or birthmarks that were initially flat or flush to the surface of the skin start to increase in elevation above the skin, but even more so start to develop depth below the skin, that elevation increase is concerning. When we see tissues that are growing rapidly into the dermis and potentially below, that's a concerning sign and should be evaluated immediately. So let's just recap here. These are the criteria, or this is a tool that you can use to evaluate moles or birthmarks that you have. And if you have any question about it, then make sure you go and see a professional. So we have A standing for asymmetry. We have B stands for borders. C stands for color. D stands for diameter. And E stands for 2 things, evolution and elevation. And it's something to also keep in mind. Even if you do not have family members that have experienced melanoma like my family has, it's still really important to keep screening. People that are fair-skinned are more likely to develop melanoma because we don't have, excessive amounts of pigment to protect us from the UV rays. And if you tend to have higher count of moles or birthmarks on your body or freckles anyway, greater number of those kinds of marks on your skin, the more you have to just be cognizant or mindful of changes in them. And something that I always remind people of is that melanoma, which is the most concerning type of skin cancer, is not a cancer that simply happens to older people. It pops up in much younger people, in fact. And so it's never really too early to start paying attention and screening any birthmarks that you have. And I would definitely recommend, if you're a parent and you have kids that have birthmarks, to just take pictures of them periodically and monitor their size, putting an object or a ruler next to it for reference. So these are the A, B, C, D, and E's of skin monitoring. And, really don't deprive yourself of sunlight and sun time this spring and summer, but just be mindful, be aware, and pay attention to your body. But I hope you all have a great week. I hope you get out and enjoy the sunshine, and I will see you all next week for another installment of Wellness Ed Sunday.